Okay,
Thank you.
you will have 45 minutes in total, 5 minutes for reading case notes, and 40 minutes for actual writing. So I would advise you to divide your time in three parts, like first 10 minutes, 30 minutes, and then 5 minutes. Okay, you will divide your total 45 minutes, three parts. So use first 10 minutes to organize your letter. Okay, first 10 minutes to organize your letter. So what will you do? How you will organize your letter? First 10 minutes. You are supposed to read writing task twice. Okay. While reading writing tasks, identify following things. Like ask yourself these questions: that what is the type of the letter? What is the name and title of recipient? Recipient is the person to whom you are writing the letter. Okay. And what is the address of the recipient? And sometime they will mention purpose of the letter uh, in this task as well. You can check your, sorry, Nawaz is not hearing my voice. You can check your mic or head. Okay. Sometime they will give you purpose of the letter as well. Okay. Let me show you. Okay. So writing task will be at the end of the case note, just like this. Right? Case note starts from here, and this is second page, and in the end you will see writing task. For example, what is the writing task? You are uh, you're supposed to read it twice. Write a letter addressed to Dr. Clean Howard. So this is the name and title of your recipient. Means you are writing this letter to Dr. Clean Howard, 249 Wickham Place, Brisbane 4001. This is his address. Okay. Explaining the patient's current condition. Okay, you will address this letter to Dr. Glenn and you will explain patient's current situation. In your answer, expand the relevant case notes, complete sentences. You will have this type of short points, short case notes. So in your task, you will need to expand these case notes. Do not use note form. Like this is note form. This is only note form. You are supposed to write complete sentence. You are not supposed to read note form. Okay, and use correct letter format. I will. This is our topic. Okay, I will tell you what is the format of letter. One more thing: the body of your letter should be approximately 200 words. Okay, use correct letter format. So these instructions will be same for all the letters. Okay, so the thing is, relevant thing is this: we got our information from here. Now, what will we do in first 10 minutes? What else we will do in first 10 minutes? Like we will read writing task twice and then read case notes twice and ask these questions to yourself. So there will be some more information in case note, and you're supposed to find those information and write them down. Okay. So ask these questions: that what is today's day? Look for this information. Writer's profession. Either if he or she is a nurse or a doctor or occupational therapist or physiotherapist, okay, or some consultant, name and age of patient. Then, number two, any kind of history of the patient. Look for any kind of history is there or not. Okay, you might get past medical history, medicine history, past surgical history, allergic history, family history, travel history, occupation history, social history, his living condition. and smoking history, alcohol history, okay, and uh, other kind of history as well. Okay, look for any kind of history. If,
Dr.
that
Abdullah, Dr. Abdullah, what do you mean by writer's profession? You mean to say the whom we are writing the letter? Who's
yeah, sometimes, sorry, sometimes your profession. What is your profession? Maybe you are a GP. Maybe you are a
Mhm.
GP and you are writing to a consultant, or maybe you are a consultant and you are writing to someone else. Okay, your
Okay, means
profession.
we have to write as our profession, the who is writing the letter.
Yes, first you will identify that what is your profession. Okay.
Okay,
Like
thank you. Mhm.
just identify. This is the identification stage. Okay, I will tell you further things in next stage. So, what is writer's profession? Like, what is your profession? Most of the time in referral letter, you will be a GP. Okay, you general physician will be writing a letter to consultant most of the time. Okay, so name and age of patient, any kind of history of the patient, if there is any. Okay, how many visits? Number three, how many visits of the patients are there? Okay, maybe only one visit, two, three, four, five, or more than that. Okay, they can give you any number of visits. Okay, so just identify that how many visits are there. Then number four, what is happening in each visit? Like first visit, he presented to you with some complaints. Then what happened in next visit? Either his condition is getting worse or getting better. Then what happened in the latest visit, which will be today's visit? Okay, which will be today's visit. So just try to comprehend the situation of the whole scenario, whole case notes, and of the situation of the whole letter. Okay, next. Number five. Number five, you will identify, like there are, for example, there are two visits. You will identify components of each visit. What are components of each visit? I usually give this example to my students that consider this like you are sitting in your clinic or OPD. Okay, then a patient comes to you. What will you ask? What will be the first thing you will ask from him? Presenting complaints. You will ask about presenting complaint. Then history, like you have identified history here. Okay, for example, you have identified history here. Then you will take his vitals. You will do examination and look for any findings. Then maybe you will order some investigation, some blood test, or maybe if that is his follow-up visit, you might receive some results from previous visits, okay, from previous consultation. Maybe this is a follow-up visit. Okay, next there will be treatment option. There will be some medication, lifestyle changes, or rest for the patient. There might be some follow-up, and then you will make uh, like diagnosis, okay, or some you will make some provisional diagnosis, and if that is follow-up visit, then you will uh, notice if there is any change during follow-up visit. So these are components of each: presenting complaint, vitals examination, blood investigation, blood and test and investigation, some treatment option, follow-up diagnosis, and any change during follow-up. So you will be looking for these information. Now, look at these cases. So we have identified our name and title of our recipient, and address of recipient. Then what else I have told you to look? I told you to look today's date, writer's profession, name and age of patient, and history, and then visits. So we will be looking for, this is today's date. Yes, this is today's date. James Warden is the name of patient. This is his date of birth. Okay, regular patient, your general practice. So who are you? You are a GP. You are in general practice. You are a GP. This is your profession. And look for that how many visits are there. For example, uh, today's date is 25/08/12. Okay? And first visit is on 9/07/12. second visit is on 25/08/12. So this is today's date. Okay, this is today's date. So this is the most recent visit, and okay, only two visits are there. Okay, so what will you do now? You will look at what's happening in each visit. What is presenting complaint? What is what is the patient history? What is presenting complaint? And what are examination findings? And then what investigations are being done? What blood tests are being done? What treatment options and management options are being utilized? And follow up and diagnosis. You will all these things. This is we do commonly in our practice. Okay. So I want any volunteer who can read this from here. Objective. Any volunteer.
Hello.
Okay. Who's there? Dr. Fatima.
Yeah.
Okay, you can read. Start from this objective.
Okay. Subjective. Wants regular checkup, has noticed small swelling in right groin, hypertension diagnosed 5 years ago, non-smoker, regularly drinks 2 to 4 glasses of wine nightly, and 1 to 2 glasses of scotch at weekend. Widow living on his own, likes cooking and says he eats well. Current medication noted, 50 milligram daily, half aspirin daily, Normicin 10 milligram nightly when required, 50 plus multivitamin 1 daily, allergic reaction to penicillin.
Yes, keep reading.
Okay. Objective. A blood pressure 155/85, pulse 80 regular, cardiovascular and respiratory examination normal, urine analysis is normal, slight swelling in right groin consistent with inguinal hernia. Plan, advised reduction of alcohol to 2 glasses maximum daily and at least 1 alcohol-free day a week. Discussed options, hernia. Regarding hernia, patient wants to avoid surgery. Advised to avoid any heavy lifting and review blood pressure and hernia in 3 months.
Okay, stop. Thank you. Okay, so what's happening? Like patient presented to me on this is his first visit, this is first presentation on 9 July 2012. Okay, so he wants regular checkup. Like first of all, you will understand these case notes, that what's written here. Okay, then you will be able to organize them, and then you will transform these into sentence. Okay, so he wants regular checkup. Why? Because he has noticed small swelling in right groin. Okay, this might be his presenting up there. Then past medical history. He's diagnosed 5 years ago. Like he has hypertension and diagnosed 5 years ago. Smoking history, non-smoker. Drinking history, alcohol history. Yes, he drinks 2 4 glasses of wine nightly and 1 to 2 glasses of scotch. So like he is drinking more than recommended one. Just assume, because like you don't know exact what how many units are permitted, but because you are seeing that okay, he is drinking 2 4 glasses and 1 to 2 glasses of scotch, so you can say it's more than recommended. Okay, next is social history. Living, he's a widower living on his own, likes cooking, says he eats well. Current medications, Norton 50 mg daily, half aspirin daily, Normas 10 mg nightly when required, 50 plus multivitamin. So these are medication history and allergic testing. This is allergies. So everything except this first sentence, everything is history. Okay, now move next. So next, what will be the next thing? This might be presenting complaint, small swelling. So now next thing is examination. So vitals are also a form of investigation. Okay. So examination finding, blood pressure raised, pulse 80 regular. Like this is normal finding. Okay. So most of the time, we do not mention normal finding in our letter most of the time, unless it's relevant. Okay, unless it's relevant. Okay, cardiovascular respiratory examination, normal urinalysis, normal slight swelling, right groin, consistent with inguinal hernia. So what happened? Now I have examined his right groin, and I have seen that there is a swelling, uh, and I am making my diagnosis as inguinal hernia. A GP can make this diagnosis. This is very easy. Inguinal hernia diagnosis is very easy. Okay, next, what was my plan? Because swelling was small. Okay, so I advised him because he's drinking more. Okay, now this information reinforced my point that he's drinking more. That's why I am advising to reduction of alcohol. Okay, it means he's drinking. He's already taking more than recommended. So what is my plan? Advise to reduce alcohol to glass max daily and at least one alcohol-free day. Okay. Discussed options regarding hernia. RE mean regarding. Patient wants to avoid surgery. So this is patient's perspective. He wants to avoid surgery. Advised to avoid any heavy lifting and review blood pressure and hernia in 3 months. So I advised him not to lift anything heavy and review blood pressure after review of blood pressure and hernia after 3 months. Okay. So but you know he now he's presenting to me uh, on in 25 August. It's not 3 months. Okay, it's not after 3 months. So and this is also the today's date. This is today's date as well. Okay, so we will read this again. For example, had problem lifting. So what's happening now? This first visit has finished. Now we have started second visit. What's happening in the second visit? Had problem lifting heavy wheelbarrow while gardening. It has a regular dull ache in right groin. Notice swelling has increased. So what's happening? He he lifted some heavy weight. Okay, he has lifted some heavy wheelbarrow while gardening, and now a dull pain has started in his right groin, and swelling has increased. Has reduced alcohol intake as suggested. I advised him to reduce alcohol, and he has reduced alcohol consumption. Okay, next. So objective, like on examination, objective means like I am examining. His blood pressure is okay in normal range, pulse regular, normal, marked increase in swelling, right groin, and small swelling in left groin. So what's happening? Presenting complaint. What's changing? Like now there is a swelling on left groin as well, along with marked increase in right groin swelling. Okay. So on assessment, now my diagnosis has changed and it has become as bilateral inguinal hernia. And I advise patient you want to refer him to surgeon. Now I want to refer him to surgeon because he is having pain, swelling is increasing. Okay, things are not in our hand now. Okay, I am a GP and I want to refer him to a surgeon. Look, they used this word here. Advise patient you want to refer him to a surgeon. So now you know that this is a referral letter. Okay, most of the time they will mention writing task here. Write our referral letter. Okay, most of the time they will mention this here. But you can also, by reading the case notes, you will get to know that what type of the letter it is. Like here, they mentioned the writing task here in the assessment part of second visit. Okay, so you want to refer him to a surgeon. He agrees, but says he wants a local anesthetic as a friend advised him he will have less after effects than with general anesthetic. Okay, so he wants local anesthetic. Now we know that in second visit what happened. For example, what is our understanding, like what's happening in second visit? So uh, he lifted some heavy object and now he also reduced alcohol consumption, but now his swelling has increased on right side along with another swelling on left side. Left groin is present now. Okay, my assessment is bilateral inguinal hernia. Things are not in line. and that's why his condition is getting worse. That's why I am referring him to a surgeon. Okay, so this is my understanding of case. Okay, what I have done, I have followed these steps. Like in 10 minutes, do these. Like you are supposed to read writing task twice. Okay, type of letter, name, title of recipient, address of recipient, purpose of letter. Now you know all of these things. Okay, and also you know today's date, writer's profession. You are a GP. Okay? You are writing from general practice. Name and age of patient. Yes, I know that. History. I know that. How many visits? There are 2 visits. What happening? What is happening in each visit? I know that what happening in each visit, and I have clearly identified these components in each visit. Okay. Now what next? So if with practice you will have time to like in your mind you will know that how you will transform these case notes in your sentences with practice. Okay, but for instance, like this class is for just beginners. So now you know that what's happening in each visit, and you have read these case notes and writing tasks twice. So now I suppose that we will use next 30 minutes. Okay, so how you will use, what will you do in next 30 minutes? You will follow the main format of the letter. Okay, let me show you what is the main format of letter. Like you will write the final letter will be in this form. Okay, this form. Okay, I have divided this to make things simpler. So this is the recipient and patient information. You will write these information like this. This paragraph will be introduction. Okay, next this is main body of the letter. Like uh, this is first visit. In this paragraph, you're writing about first visit, and today means this is second visit. Okay? This is sorry. This is second visit. Today is the date of second visit. So you have written details of second visit here. Now the last paragraph is about conclusion, and in the end you will do ending like this. This is a general
Where,
format.
where is the purpose?
Purpose, you will write this in introduction part. Okay, you will write this in introduction part. I will come to that point as well. So main format, like information of recipient, where you will know these information, like these information. You will know these information from case note and writing task. Okay, let me show you what information are these. Uh, Dr. Glenn Howard. This is name of your recipient. You can find this in writing task. Surgical department, and this is address. You can write this. You can find this writing task. Dear Dr. Howard. Again, this is I'm not using his full name now. I'm just using title and family name. This is patient's name regarding RE mean regarding Mr. James Warden, and this is date of birth of patient. I found this information case. Okay. Now the second thing is introduction. Okay. Information of recipients. I can get these from writing task and case notes. And about introduction, I can like for introduction, you have to memorize 2, 3, 4 types of introduction, and you can utilize them according to the situation of the letter, according to uh, the case note. Okay, just memorize 2, 3 types of uh, introduction, 2, 3 patterns of introduction. For example, let me show you. For example, this is one pattern. I am writing to refer Mr. Warden, a widower, who is presenting with symptoms consistent with a bilateral inguinal hernia. He needs further management of his condition. So in introduction, you will write type of the letter. This is referred. Okay. Name of your patient. maybe some additional information, like here I mentioned a video. Okay, and purpose of the letter, like why you are writing. You are writing because he needs treatment of bilateral inguinal hernia. This is the reason. This is the purpose. You are writing as to a surgeon because he is having bilateral inguinal hernia. And what does he needs? Like this is the purpose, and you need to expand the purpose in production. He needs further management of his condition. This is the expansion of the purpose. So everyone is listening me clearly, because someone is saying that voice is not clear. My voice is clear.
Yeah,
Yes, your voice is clear.
Okay, then there might be some problem in the internet. Okay, next. So introduction. Okay, next thing is main body of letter. Okay, this is your main task. This is the like main uh, main core of the letter. Like here, you will need to transform case notes into sentences. You will be using your grammar, your uh, case note selection skill, and your uh, sentence formation skill, and everything, punctuation. And you will be using a lot of things here. You need a lot of skill to write main body of letter. So for example, how we're going to write this. First, let me tell you, there will be a conclusion as well. Again, you will memorize different types of conclusion. There is some longer formats of conclusion and shorter format, so you can use them according to the situation. And ending is really simple. Like ending is this: yours sincerely, doctor. You might write your name as well. You can write your name, and this is conclusion. Okay, this is a very short part. You can memorize it. So, uh, okay, here it is. How to write each visit. Okay, like now I'm going to write visit. So try to write them in sequence. What sequence? Sequence of components of visit. Like first presenting a claim, then examination findings, then treatment options, follow up, like that. Okay, so on. And try to group similar information together. Like if you are mentioning presenting a claim, try to write that in one sentence. If there are more than two, three, four, five complaints, okay, you can write them in one or two sentences, like uh, consecutive sentence. Then examination finding, you can group them together. Okay, you can group them together, and for maybe they will give you lab results of 10 blood tests. Group them together. Okay, group similar information together. Treatment options, yes, there might be more than five, four, five, six options. Group them together. Every similar information, group them together. Then, how you will do case note selection? Okay. Try to highlight or like underline or divide the case notes in three categories. Okay. Ask yourself if this is relevant case note or irrelevant case, or maybe they are semi-relevant. Like you will be confused that okay, they are relevant or not. Maybe they're just semi-relevant. They are a little bit relevant. So you will definitely you will not miss relevant case, and definitely you will not include irrelevant case. Regarding semi-relevant case, you will write some of them, or maybe you will just give a touch of them. You will just write them in short form, or like uh, you will just give. You will write a one heading. You will generalize that information, which is semi-relevant. Okay. So this is very important, because otherwise, if you will not follow this, you will mess up with your word count. Okay? You will increase your word limit if you do not follow this. Okay, I am sharing the link again. Okay, because this link is expiring. There was only 45 minutes. So I am sharing the link again in the class. Please, everyone rejoin this class again, and I will show you how to write these visits and how to transform those case notes into complete sentences. Okay, I'm sharing the link again in the